Hi everyone, in today's video we are going through often repeated questions on the physiology of the blood. Question number 1. What is the primary function of red blood cells? A. To produce antibodies. B. To transport hormones. C. To carry oxygen. And D. To defend against pathogens. Our answer here should be C, to carry oxygen. Red blood cells contain hemoglobin, which binds oxygen in the lungs and transports it to other cells or tissues. Question number 2. Which components of the blood is involved in clotting? We have A. Erythrocytes, B. Leukocytes, C. Platelets, and D. Plasma. Our answer here is C. Platelets. Platelets, also called thrombocytes, are cell fragments that helps form blood clots to stop bleeding. Question number 3. What is the average lifespan of a red blood cell? A. 10 days, B. 60 days, C. 120 days, and D. 1 year. Our answer should be C. 120 days. Red blood cells typically live about 120 days before being removed by the spleen and the liver. Number 4. Which plasma protein is most abundant and helps maintain osmotic pressure? A. Globulin, B. Albumin, C. Fibrinogen, and D. Hemoglobin. Our answer here should be B. Albumin. Albumin contains oncotic pressure, which helps to keep the fluid within the blood vessels. Number 5. What is the main role of hemoglobin? We have A. To break down glucose, B. Carry iron, C. Transport oxygen and carbon dioxide, while D. Maintain blood pH. Our answer here should be C, which is to transport oxygen and carbon dioxide. Hemoglobin binds with oxygen in the lungs and releases it to other tissues, and it also carries carbon dioxide back to the lungs. Question number 6. Which white blood cell type is most abundant in the blood? A. Basophils, B. Eosinophils, C. Lymphocytes, and D. Neutrophils. Our answer here should be D. Neutrophils. Neutrophils are one of the most numerous white blood cells, and they are the first responders to bacterial infection. Number 7. What stimulates red blood cell production? A. Insulin, B. Hemoglobin, C. Erythropoietin, and D. Glucagon. Our answer here should be C, which is erythropoietin. Erythropoietin is a hormone from the kidneys that promotes red blood cell formation in response to hypoxia. Number 8. Where does hematopoiesis, which is blood cell formation, occur in adults? A. The liver, B. The spleen, C. The red bone marrow, and D. The thymus. Our answer should be C. The red bone marrow. In adults, all blood cells are formed in the red bone marrow, primarily in the pelvis, the ribs, and the sternum. Number 9. Which vitamin is essential for blood clotting? A. Vitamin A, B. Vitamin B12, C. Vitamin C, and D, vitamin K. Our answer here should be D, vitamin K. Vitamin K is required for the synthesis of clotting factors in the liver. Question number 10. What is the normal pH range of a human blood? We have A, 6.8 to 7.2, B, 7.35 to 7.45, C, 7.8 to 8.2, and D, 6.0 to 6.5. Our answer here should be B, 7.35 to 7.45. And this is because the blood is slightly alkaline, and this is to support enzyme activity and also cellular functions. Question number 11. Which element is crucial for hemoglobin synthesis? A, calcium, B, potassium, C, iron, and D, sodium. Our answer here should be C, iron. Iron is a key component of hemoglobin, and it is essential for oxygen binding and transportation. Question number 12. Which type of white blood cell is primarily involved in antibody production? A, neutrophils, B, basophils, C, B, lymphocytes, and D, monocytes. Our answer here should be C, B, lymphocytes. B cells differentiate into plasma cells that produces antibodies during an immune response. Question number 13. Which blood components contains the clotting factors and nutrients? A, red blood cells, B, white blood cells, C, platelets, and D, plasma. Our answer here should be D, plasma, because plasma is the fluid portion of the blood that transports hormones, nutrients, waste products, and clotting protein. Question number 14. What is the function of fibrinogen? A, to destroy bacteria, B, to bind oxygen, C, maintain pH, and D, form blood clots. Our answer here should be D, form blood clots, because fibrinogen is converted to fibrin during clotting, forming a mesh that stabilizes the clots. Question number 15. Which organ removes old or damaged red blood cells from circulation? A, the liver, B, the kidneys, C, the spleen, and D, the lungs. Our answer should be C, the spleen. The spleen acts as a blood filter, removing aged or damaged red blood cells. Question number 16. Which blood group is considered the universal donor? A, AB positive, B, O negative, C, A negative, and D, B positive. Our answer here is B, O negative, because O negative blood has no A, B, or Rh antigen, making it safe for all recipients in emergencies. Number 17. What is the average volume of blood in an adult human? A, 2 to 3 liters, B, 3 to 4 liters, C, 5 to 6 liters, and D, 7 to 8 liters. Our answer here should be C, 5 to 6 liters, because most adults have between 5 to 6 liters of blood depending on size and sex. Question number 18. Which hormone helps to regulate the white blood cell production? A, thrombopoietin, B, erythropoietin, C, cytokines, and D, calcitonin. Our answer here should be C, which is cytokines, because cytokines, like the interleukins and the colony stimulating factors, help to regulate white blood cell formation and immune responses. Number 19. Which of the following is a granulocyte? A. Lymphocytes, B. Monocytes, C. Neutrophil, and D. Erythrocytes. Our answer here should be C. Neutrophil, because the neutrophils are a type of the granulocytes characterized by the cytoplasmic granules and is involved in acute inflammation. Question number 20. What is the primary function of eosinophils? We have A. Oxygen transport, B. Destroy parasites and moderate allergic reactions, C. Produce antibodies, and D. Initiate blood clotting. Our answer should be B. Destroy parasites and moderate allergic reactions. Eosinophils actually combat parasitic infections, and they are also involved in allergic responses by helping to moderate histamine activity. So there you have it, 20 questions on the physiology of the blood. I hope this helps you in whatever examination you are preparing for, and I also hope you like and subscribe this video for more videos like this. See you next time. Bye.